Hello, and welcome to today's webinar, Using Data to Avoid Low-Value Care. Before we get started, I'd like to review a few housekeeping details. Today's webinar is being recorded, and an online archive of today's event will be available a few days after the session. If you have trouble seeing the slides at any time during the presentation, please press F5 to refresh your screen on your PC or Command R if you're using a Mac. You may ask a question at any time during the presentation by typing your question into the Q&A box located on the right side of your screen and pressing Enter. And finally, I'd like to remind you of AHIP's antitrust statement located in the handout section at the bottom of your screen. We will, as always, comply with that statement. Among other things, the antitrust statement prohibits us from discussing competitively sensitive information. We're very fortunate to have with us today Leah Binder, Michelle Merchant, Bill Payne, and Barbara Wentworth. Leah Binder is the president and CEO of the Leapfrog Group, a national nonprofit representing employers and other purchasers of healthcare calling for improved safety and quality in hospitals. Under her leadership, Leapfrog has fostered groundbreaking innovation in transparency, quality, and payment policy, beginning with the annual Leapfrog Hospital Survey, and in 2012 launched the Hospital Safety Grade, which assigns letter grades on the safety of general hospitals across the country. Michelle Merchant leads the network hospital relations team and coordinates network communications for all Horizon Blue Cross Blue Shield of New Jersey participating providers. In this role, she serves as the health plan's primary liaison of all its network hospitals and the New Jersey Hospital Association on operational matters. Currently, Bill Payne serves as Director of Strategy Advancement on the Discount and Trend Management team at Humana Government Business. He oversees the analysis and planning to support various units in the delivery of the TriCare East discount guarantee. Bill has more than 33 years of leadership experience with Humana, accumulated in the hospital, health plan, and health solutions setting. Barbara Wentworth is a senior quality improvement specialist at HealthNet, a California-based insurance company that provides health plans to individuals, families, small and large businesses, people with Medicare, and those covered by Medi-Cal. She directs quality improvement initiatives focused on raising hospital quality across ranges of measures, including those targeted by California's state-run exchange program, Covered California, in which participating health plans work toward collective goals. At this time, I would like to turn the floor over to Leah Binder from the Leapfrog Group. Welcome.
Thank you so much. I appreciate this opportunity for us to be together, and I very much appreciate my colleagues on the panel today. I am very excited that we have three of, I think, some of the leading executives in this world of value-based purchasing and this world of really of health, really thinking differently about how we strategize the purchase of health benefits in this country. I'm really excited to have three really pioneering innovators in this space to join us today and have a really, I hope, robust conversation with all of you about where things are going and where they're headed. So let me talk first about the Leapfrog Group and our views on the issue of value. Value is a combination of price and quality. But we think quality is the very foundation of value. And first and foremost is quality. Just as you would not buy a house, even in today's real estate market, most of us would not buy a house that had a faulty foundation. You don't want to buy healthcare services that don't have quality as their fundamental feature. Quality without quality, you do not have value. There is no good price for bad care. And by that I mean, particularly, the kinds of errors and accidents that we know happen too often, but they do happen in healthcare, that are a real problem, and particularly in some hospitals or some settings, more than other settings. They are the things that are easy to happen. You missed a dose, missed a lab test, forgot to wash your hands, or just forgot something else, gave something to the wrong patient, etc. Sometimes they're even catastrophic in nature, like you left a sponge in after surgery. Sometimes they aren't catastrophic and the patient is okay, but they are still problematic and mostly preventable. So we know that, again, that these happen in some places more often than others, that some hospitals are much more successful at preventing them than others. There are techniques to do so. And we need to make sure that when we think about value, we think first about how we can reward those hospitals and health systems that do the best job. And when they make that effort, when they improve, we reward that as well. That needs to be the very essence of value, because there is no price for this. There is no price for a surgical site infection that any of us want to pay. We want the value to be there, and the value starts foremost with the quality. And so that's what Leapfrog has been about from day one. It's the foundation of our organization, quality. We were founded in the year 2000, so we're now coming up on our 21st birthday. We were founded by purchasers, by some employers, some very large employers. Some of the logos are here. Really out of the report in 1999 to Errors Human that said that upwards of 100,000 people were dying of the errors and accidents that I just described in the last slide. And even today, now that we know more about those errors and accidents and their frequency, now the literature suggests the number may be more like 250,000. So the problem, I'm not sure the problem has gotten worse. It's simply gotten more transparent as we've been able to measure it more accurately. But in any case, these purchasers were extremely concerned about these errors and accidents. They were concerned in part because they're terrible. They don't want those to happen. They don't want to pay for that. But in addition, they were also concerned because they didn't know about it. Because of all their efforts over the years to try to control their own health costs, to try to get better care for their employees, it's just not apparent on their claims data that they'd studied for so many years. It wasn't apparent that all these problems were happening. So they wanted a way to have more transparency in the healthcare system so they could see where these were happening, so they could help their employees make better decisions about where to seek care, and really drive a market for the best care at the best price, what we call value. We work at Leapfrog. We are a nonprofit. We're national. We work with regional health plans, transparency vendors, consumers, and our goal is giant leaps forward. So that's why we're called Leapfrog. They didn't call us the incremental group. That would have not been as interesting. We want giant leaps forward in the quality and safety of U.S. healthcare. One of our secret sauce recipes is our partnership with regional leaders. We work with over 35, mostly business groups on health across the country, and those business groups representing employers in their regions represent Leapfrog in their regions. So they are the organizations that typically approach hospitals, ask them to participate in the Leapfrog survey, and also work with them to use the data and to recognize improvements and recognize achievements in the quality and safety of care. This is the very essence of our effectiveness. At the national level, Leapfrog is able to work with data, collect data, publicly report data, become involved in assuring the evidence base and the integrity of the data that we collect. We work very hard to do that on behalf of all of our employers and all of the regional leaders. And then at the regional level, the regional leaders are able to have a conversation directly with healthcare providers and employers and bring them into the same room together to have this conversation about how to improve the quality of care that's being delivered to their employees. We have 4 core programs at Leapfrog over the 21 years of our existence, and they really fall into 2 categories. One is a category of collecting data. This is a unique aspect of what Leapfrog does. It remains unique. Very few organizations collect quality data other than maybe CMS. We collect data from hospitals and from ambulatory surgery centers now, and we do that through 2 instruments. One is the Leapfrog Hospital Survey, and the other is the Leapfrog ASC Survey. It's an annual survey. fielded and it's voluntary for hospitals or ASCs to participate, and that's the one where regional leaders, employers across the country, and health plans ask the hospitals and the ASCs to participate. So that's how we collect data on safety and quality. But we also have two main programs for analyzing data that's publicly reported. And those two programs are the Leapfrog Hospital Safety Grade and the Leapfrog Value-Based Purchasing Program. The Leapfrog Hospital Safety Grade is one that I think most people know us for. This is an ABC DRF that we give every general hospital in the country, regardless of whether they voluntarily report to one of our surveys. We give them this grade on how safe they are for their patients. The Value-Based Purchasing Program is another program where we analyze data that we have on the safety and quality of hospitals, and we issue composite scores so that health plans and employers can benchmark performance of different hospitals on their safety and quality. But the collection of data is one thing, and the analysis of that data is another that we do. And all of this contributing toward public reporting by hospital or by ASC on the safety and quality of performance, and assisting employers and health plans in strong, robust strategies for purchasing health benefits in a way that promotes and rewards quality and safety. So foundational to employers' value strategy and for our work at Leapfrog is that we are by, for, and about employers and purchasers. Our first priority is we collect data that matters most to employers and purchasers, which also happens to matter most to their employees, and we give them information that they ask us to provide. So we are all about making sure that employers get what they need to feel comfortable and to feel strategic about driving this market for quality. We pinpoint waste. We're looking for figuring out where is the problem in healthcare. It's not enough for us to say, well, the U.S. has an infection rate of X, Y, or Z. We want to say, where are the problems? Where's the variation? Which are the hospitals or ASCs where there is a problem, so that we can directly work with them to either improve or to not be rewarded for not performing at the level that employers expect. Our science and evidence base that we develop at the national level for employers is top-notch. We have a very strong reputation for bringing together top expert panels for virtually everything we collect data on or we publicly report. We work with the Armstrong Institute for Patient Safety and Quality, which is at Johns Hopkins Medicine. And again, we have a number of expert panels that work closely with us. Everything we do is tested, verified, and evidence-based, and it results in performance data comparable across the hospitals and across ASCs that's not available from any other source. We collect information that you cannot get from claims and that employers want. So what we get are valid benchmarking by facility on, again, the key issues that are of great importance to employers. And this slide lists a few of those areas of great importance to us. Whether it's, does the hospital do a good job of maintaining a culture of safety, such as hand hygiene? And do they have the kind of outcomes that we're looking for? Do they have patient experience reports that are suggestive of a safe place? How's maternity care? We have the only data on C-section rate by hospital across the country, a standardized NGSC C-section rate. So it results in a wealth of data and information, again, available from no other source. So that's what purchasers can get. What consumers get is usable information. This is our letter grade ABCDRF, available for free to all consumers and available to anyone who wishes to license it, but it is available to consumers and widely covered in the media and really driving attention by consumers to the issues of patient safety so they can make good decisions. These are life and death decisions for consumers to make. What providers get from Leapfrog is also powerful. They get recognition. When we have a fee-for-service system, too often the ones really harmed by fee-for-service, in addition to patients, who's really harmed by fee-for-service are people who work in healthcare, because excellence is not noted. Excellence doesn't matter in fee-for-service. You just get paid no matter what. So we know when you put the effort into patient safety, which is not a small thing, we recognize it is a very difficult enterprise to continuously, 24/7, maintain a safe environment that puts the patient first. We get a reward, and that reward gets shared by everyone who works there, as it should be. And so we are very proud of the fact that providers take such pride and get such satisfaction out of participation in Leapfrog and recognized for their excellence. What plans learn from Leapfrog is they have a treasure trove of analytics to use. Here's an example of one where we offer a benchmarking, for example, on maternity care, which can be immediately tied to a value-based contract, to steerage, to tiering, etc. It offers tools that are easily leveraged in a value contract. That is of importance to employers and other clients. So, as we talk today, I hope that employers will be thinking about quality as that foundational principle for value, and for avoiding low value, you have to have high quality. And we hope that you'll think about satisfying employers' demands for quality-driven value. That is a major principle for hundreds of employers, at least that we work with, and they are very strongly tied to this equation that I've about putting the quality first. I think plans, we hope, are thinking about growing consumer demands for transparency. Consumers, including those like millennials and younger, are looking for instant access to information that they can use to make good decisions. They expect that now. Transparency has become the norm in every other industry, and healthcare is so as well. So how you can foster transparency as a core principle of value. Reducing wasted lives and dollars by tying your payment to true value, so tying payment to true quality. And then how health plans can get measurable results and see that as a competitive edge in the marketplace now. That is what employers are looking for. And then finally, I think most importantly, the value movement sounds like a big lift for many health plans. So with that, I will now turn it to our first speaker after me, and as we're all thinking, I introduce Michelle Merchant, my friend.
Good afternoon, and thank you, Leah. I'm Michelle Merchant, and I represent Horizon Blue Cross Blue Shield of New Jersey. Just wanted to share a little bit about Horizon Blue Cross Blue Shield. We are the largest commercial insurer in the state of New Jersey. We represent about 30% of most of our network hospitals, which at this point is every single hospital within the state of New Jersey and some in the surrounding counties of Pennsylvania and Delaware. And we are also the largest managed Medicare insurer, the largest managed Medicaid insurer within the state, and we are also the insurer of choice for the state of New Jersey, for their employees and their teachers in the various school districts. So we are very rooted in New Jersey. We've been around, it's almost 100 years, and we have over 3.8 million members. We began our partnership with Leapfrog back in 2006, and again, our desire to partner with Leapfrog was prompted by their reputation of transparency, with their survey being open to the entire country and then the results being analyzed and reported publicly. We also know that they were endorsed by significant purchasers who were also a part of our insured population, and so they came with a lot of credibility. And our idea behind the partnership with Leapfrog was to help hospitals really get on the accepting of transparent reporting, focusing on improving quality performance, and having a tool in place that we can then use with our insured to ensure that we could show that we are truly invested in helping our hospitals measure quality. We're doing so in an unbiased way, and we're driving for improvement. And I think my slides today will show that we have excelled tremendously in our objective of having hospitals commit to that transparency and then driving towards improvement. So as I mentioned before, we've been 13 years with Leapfrog. It's actually 15 years now, and that's been uninterrupted affiliation. When we first started in 2006, we had 8 hospitals that completed the Leapfrog hospital survey. In 2019, we have 70. That represents the entire New Jersey hospital network. And we got there with a number of different initiatives. First, we offered a financial incentive for them to participate. We stopped doing that in 2010. However, they have continued because they've seen the benefit, and the financial incentive was not as significant in terms of hospital spend, but it was a way to compensate for their time and the resources for completing the survey. And when you have everybody on the same page looking at these measures, we know they're going to drive towards improvement, and we've seen that. For example, in 2006, there was only one hospital of the 8 that was the top hospital. In 2019, which is where I spend most of this presentation, only because 2020, the pandemic, was such a major impact, adverse impact to New Jersey and to our hospitals in particular. So Leapfrog, as you know, allowed hospitals to use their 2019 data in 2020, and some of our hospitals in New Jersey took advantage of that because of the impact. So I will spend most of my time talking about 2019, but I do have some 2020 data in my slides as well. But we went from 1 in 2006 to 14, and then we also, when we first just say 4 years into the program, we were beating the national averages on quite a few measures, mostly, 15 out of 24. But by 2019, topping the nation in 23 out of 27 measures. And again, that is a testament of the attention and focus of our hospitals on the various metrics. With that, we also saw some improvement in the value score as well. So, for example, I just took the last 4 years from 2017 to 2020, and we've seen an improvement in the overall value score of all the hospitals that have completed the survey, and it's going in the right direction. They are moving upwards. And then when you look at hospitals' improvement, their individual performance, for the hospitals between 2016 and 2019, the hospitals that were in common, 66 out of those hospitals, 52 of them had at least 1 percentage point increase. 21 had up to 10 points increase. Again, because of the focus and attention and resources that they used to make improvements. And 4 had improvements over 20 points. So it just showed that not only was there overall, but individual improvements as well. And then we looked at some particular areas of the various metrics that Leapfrog had in place. And one area that we struggled a lot in New Jersey was the NTSV C-section rates. These are the single births where vaginal delivery should be expected, but instead it results in a C-section. And the Leapfrog average is somewhere about 23% or so. And you see that New Jersey was exceeding that number significantly. However, over time, that number has decreased, and that has continued if you look from 2009 to where we are today. And this didn't happen by chance. We really spent a lot of focus and attention. We had best practice meetings where hospitals who were doing well with different initiatives to reduce C-sections would share their experience with other hospitals at an annual in-service that we would provide. We also started to collect individual claims reports and share with hospitals. Also, Leapfrog made some of it public, and so there was, press release and different articles about the performance that caused hospitals to take action. Some of them created their own dashboards of the obstetricians within their teams that also drove some of those improvements. So again, though, it's an example of where we made some improvement. This, when you look at this, I'm looking at, say, two areas of the metrics, the barcode, medication administration, and early electives. When you look at overall the network, those who were high performing and those who were less performing, and there was variation in performance. But if you look in terms of from 2016, the gap, the standard deviation was much wider, but by 2019, we were closing the gap in a lot of these measures as illustrated by the medication administration as well as the overall delivery of care. So that's a good thing. So this is for the whole network. We were showing decreases in the variation. And then when we looked at, I apologize, my navigation is not the best, but when we're looking at a variety of measures and we're looking at just the top 10% of the hospitals versus the bottom 10th, we've seen again that the gaps are closing, because if you look in 2016, for example, the gaps in care between, say, in medication, there was a gap, but when you go to 2019, even the lower performing hospitals, they've caught up almost with medication administration. If you look at inpatient care, there was a much bigger gap in 2016 between the top performing hospitals and the lower. And that became important to us for those gap closures because, as I mentioned, every hospital is in our network. So we don't want to see that type of variation in care. And so to the extent that we're seeing those improvements, that's a wonderful thing. And then, so this year we have, last year, as you know, Leapfrog introduced the outpatient services and the outpatient survey, and many of our hospitals completed that survey, and so far we have some good results, and we're very proud of those results, but and we hope they continue in that direction. And let me just make sure I didn't skip anything. Okay, but we still, although we've seen some gap closures and we've seen some trending in the right direction, approaching the goals and the standards of Leapfrog, we still have some work to do. C-section rates, it continues to be an area. As you noticed from one of my previous slides, we weren't quite there at the goal line yet. We still have some hospitals that their rates are much higher than we would expect. We still have some opportunities in infections, and, that's always an ongoing battle because you just need a different population of patients, and that goes differently, as well as the CAP survey with the child hospital surveys, that we've identified that as an area of potential improvement. So I thank you for this opportunity, and I just want to emphasize that we agree that there is no good price for bad care. There's no value in that. We have partnered with Leapfrog both in the hospital survey, which is the results we see here through their value-based purchasing program to monitor the activities of all of our network hospitals, but we also use the safety grade on our online directory, so that's another tool that our members can use to access care within the state of New Jersey. Thank you.
Thank you, Michelle, and it is a great honor to work with Horizon. You've really inspired us over the years, so thank you. And so now we'll turn to Bill Payne from Humana. If we can get your audio. I know we've had some audio issue there. Okay, can you hear us? Okay. Can you hear us, Bill?
Leah, would you like me to do my slides first?
Yeah, why don't we do that and we'll get the audio.
Okay.
Now we
okay,
have,
great.
Okay, you got it. All right.
We'll just go through. Let's see. Here we are. Okay.
Yeah. All right. So we'll go to Bob
thank you.
Wentworth.
Great. Thank you so much to Leah for inviting me today. I'm Barb Wentworth from HealthNet. We are a California-based plan of close to 3 million members, and we're part of the Centene family, which operates in all 50 states. And I'll be talking about our approach to hospital quality today in California, where we have over 300 hospitals. Most of those are in our network. And my focus is really about how we can work across organizations toward the quality goals that we all share and on the collective model that we use here in California. So first, why do we need to work together and seek out like-minded partners? Why can't a really determined plan build its own program and kind of drive that progress on its own? And I would say for plans like ours, where there are a lot of plans that are operating, we don't have that kind of leverage necessarily. When we go to a hospital with concerns about their performance, the share of their total patient population that we represent, the share of total patient spend, it may just not be compelling enough on its own. We have had this experience at HealthNet. We've worked with very senior hospital leadership, with our own senior leadership, and it can be difficult to get new commitments in areas that the hospital is not already focused on, and especially among poor performers. We also need to partner with the organizations that provide technical information on quality improvement to hospitals. That includes organizations like Leapfrog, which help to develop the standards on these measures and to amplify them, as well as, collecting and reporting on the data. And I think also very importantly, advocate for the data collection systems that we all rely on. We also need to partner with the collaborative learning organizations that, help hospitals to identify these specific practices that they need to adopt or change, to meet those standards that organizations like Leapfrog have established for us. And an example here is, that we work with is the California Maternal Quality Care Collaborative, CMQCC, which is an organization focused on maternal health through a range of programs. And we encourage our hospitals to work with their maternal data center, for example, which, through rapid cycle data exchange, they get very specific about the clinical changes that need to happen in a particular procedure, for example, for the hospital to get to meet the target that they're shooting for. So they really drill down into those clinical practices. And so that's the kind of technical guidance that can really help a hospital turn their performance around. And as a plan, it's really helpful to not only point to, the Leapfrog standards and say, this is what we want to be seeing, but then also to have an organization like CMQCC to refer hospitals to who can help them, achieve those goals. And then consistency, working across organizations helps us to be consistent in terms of what we're asking of hospitals, and then also in terms of providing support and that accountability. So this is across payers, plans, expert organizations, and hospitals. And the goal is, one, to identify common objectives to connect hospitals with that guidance that they may need, and then to work together to hold the hospitals accountable for making that progress that we're looking for. And just to note, we at least, we use all payer data, and so we all need to be contributing to that improvement. So, when we think about the specific opportunities for alignment, it's helpful to narrow down to some key metrics and to agree on targets. And I wanted to share a bit about, our work here in California, where our state-run exchange, Covered California, has identified metrics and targets that all participating plans need to be encouraging hospitals to meet. And this is just one aspect of a very ambitious quality program that Covered California has embraced. But in the case of hospital quality, our common focus areas are patient safety, specifically 5 hospital-acquired infections, with the expectation that that hospitals will not exceed a standardized infection ratio of 1, and then NTSB C-sections, those low-risk first birth C-section rates where we see so much unexplained variation, like Michelle mentioned. And there, again, we use the target of 29.3%. We have support for those measures from other state organizations, and I think this is part of, the exchange, kind of bringing people together. We have a data organization called Cal Hospital Compare that has produced hospital honor rolls on patient safety and maternal health, referencing the C-section performance. And plans can then promote those, right, to both hospitals and to members. And through our exchange focus, all these various stakeholders are aligning, around these very specific goals. Again, we then work with expert organizations, including Leapfrog, to clarify trends for ourselves in terms of what's happening, and then to identify opportunities for specific hospitals to connect them to support if they need it and are open to it. We have even begun collaborating with other plans, and, especially in terms of outreaching to poor performing hospitals that may be more difficult to engage. And, this is to address that leverage issue and, by coming together. Alignment in the area of member-facing outreach is something else to think about. I mentioned the hospital honor rolls, and those are announced every year by California's HHS secretary. And then, plans, other stakeholders, and the press can all promote those for our members to reference. Leapfrog safety grades are part of the methodology for our state patient safety honor roll. And then we promote those quite a bit to our members, especially using paid social media. And I'll just note that, we feel fine about the fact that those posts reach both members and non-members. We really want everyone to be using this information, and we think that benefits, the improvement that we ultimately all want to see. So, as plans, while alignment is key, we also need that flexibility. Our incentive programs across plans, will likely be structured differently in terms of, the contracting, the payouts and the withholds, and what's appropriate for a particular hospital or system, for us as a plan. Ideally, that's built on similar metrics and targets across the organizations. Hospitals will vary in how they want to pursue improvement too. Some may be open to working with collaborative learning organizations, and others may want to, pursue their own internal special teams. We want to see appropriate outcomes, and how the hospitals get there, is up to what's best for them. And then, plans need a range of options to hold, especially poor performers, accountable. Our goal for Health Net, and I think this is true of Covered California, is to raise the quality across our hospitals. We want all of our network hospitals to be meeting appropriate standards for every member. And so depending on, the hospital or system, we can use a range of tools, incentive programs, other contracting elements, pressure and scrutiny from multiple plans, as I mentioned, and then guidance to our members, in terms of hospital choice. Network exclusion is something that came up with Covered California earlier on. that's complicated. I'm sure every plan can relate to that, and it's not an easy fix. And our preference is definitely to help hospitals succeed. And so, that's initially, our focus. And so I wanted to show you a scorecard that we built, which provides a distilled snapshot of a hospital's, overall quality profile in an easy-to-read document. And I'll just show you real quick, and you can see the priority measures that plans across the board, for the most part, are referencing. We've got that Leapfrog safety grade right there. And we use this to, communicate our quality priorities to hospitals. We can easily highlight areas of concern and then consider those in the context of the overall quality profile of the hospital. We have been sharing this with fellow stakeholders, and so that helps to align in terms of metrics, of course, and then also messaging to hospitals. And importantly, our contracting staff all has access to these scorecards. So when they are preparing for negotiations with a hospital, they can pull up the scorecard, they can bring it into that meeting and introduce quality into that conversation using these third-party, well-sourced common metrics and that are agreed upon in terms of how the hospital should be performing and whether it is measuring up or not. And so that getting in that room, we feel like is a really important tool of ours. In terms of progress to date, since 2015, we have seen improvements in our HAI reporting across infections. Statewide, we perform well below the national baseline. We're in that infection reduction. Our C-section rates are a national success story. I think that's really attributed to all of these factors, CMQCC for sure, Cover California, and then the plans, really, organizing around this goal of meeting that 23.9% rate or lower. As of 2019, 67% of California hospitals were meeting that C-section target. And just, for comparison, based on the previous year's data, 2018, Leapfrog reported that the national figure was less than 40%. That California number of 67% includes integrated hospitals. So our plan rate is not quite that high, but it's very good. And we've improved about 15 percentage points in just a few years. So again, thank you very much for inviting me. Leah, it's always a pleasure, and I look forward to your questions.
Thank you, Barb. Always inspiring. Always. I love what Health Net is doing and what your leadership has been able to do as well. So now, Bill, let's hope that we can get you. We apologize for all these audio problems, but let's get to your remarks. And I think we have to go find you your slides.
All right. Hopefully you can hear me now.
We can hear you.
All right.
You're going to
we'll
find.
Go back. All right. Thank you. What I'm going to talk today is about Humana Military and our role inside of the military health plan. We call that TriCare East, and I'll share with you a little bit of data of what we call the performance-based maternity program. So our program where we use Leapfrog data to help improve the quality of maternity care in the military. Just a little bit about Humana Military. We're part of the bigger Humana. We're formed to really deliver on the TriCare contract for the Department of Defense through the Defense Health Agency. Our history has been long with TriCare. We started out in 1996. As you can see in the map there, a small contract. We serviced about 1 million beneficiaries then just in a few states. Most recently, our contract, which started in 2018, called TriCare East, covers over 6 million lives. And just a little bit about TriCare East. We cover 32 states in the District of Columbia, and we have about 700,000 or so providers in our network. We're a full-range health plan. We do all the things that a traditional health plan does. The referrals, claims, call centers, medical management, disease management, case management, and build networks. A little bit about the program we run for DHA. It started in 2019, so we don't have as much history as as Barb or Michelle on some of this, but we're just beginning. But what we do is we provide a bonus program for our hospitals that participate. If they do the Leapfrog survey, we drive all of our information there off of the survey. And what we do is we assign what we call a stork level. So there's 4 maternity measures that we look at. And if a hospital fully meets the Leapfrog measures for 3 of the 4, we label them as a silver stork. If they do 4 of the 4, we give them a gold stork. And then a bonus payment is available accordingly, 1% for silver, 2% for gold. On top of that, if a hospital is in an area where they do high-risk deliveries, they can also receive a bonus there for having a fully meets quality rating from the Leapfrog Group. The measures that Leapfrog provides in this area that we look at, I think some of the same things that Michelle and Barbara have talked about, but early deliveries, Csections, episiotomy, and just the maternity care process. Those are the 4 that we focus on. So how are we doing? In the first year, we had 260 hospitals qualify for a bonus payment. You can see 170 of those, most of those were silver stork. And we were really excited this year as we worked with facilities and saw things grow. We've actually had 450 hospitals qualify in the last reporting period for a bonus, so about 73% more. And when we look at the data, we see all kinds of exciting things happening. People moving from silver to gold. Very few folks really moved out of the program and didn't qualify. But a lot of it, I think, really comes from more and more hospitals willing to take the survey and share their information so that we can, in turn, share that information with our membership. So we're really excited about the growth. Going into this year, we were a little nervous with all the things going on with healthcare in the United States and the pandemic, whether hospitals were going to step up and really complete the survey. So I think it's a testament to the Leapfrog Group and really all the work that plans like Michelle and Barb are running that really encourage, these providers to continue. I think it shows that we've got some sticking power there, and we're really driving these quality measures. So we're excited about where we've come and kind of where we're heading. And just a little bit about how we present the data. This is just a quick snapshot of our directory. You'll see that a hospital will come up. If you're searching our directory, you can see that they're labeled a silver medallion here. And what we try to do is, if you hover over that, you'll get more details about what that means. One of the things we felt important was not to overwhelm the beneficiary with a bunch of data. That's why we kind of came up with a stork level. So, you're either you're a silver or you're a gold. If you want more details, there's a lot of information you can click through and get to the details. We thought just in general we wanted to make it real simple for the beneficiary to see and to navigate and to understand what's quality and what's not. So I believe that's the end of what I have. I think Leah, back to you for questions.
Thank you, Bill. You are the newest of our panelists, newest participant with Leapfrog's programs, but you've certainly shown your leadership. This is really great results to see already at such an early stage. So, and all 3 of you have just been extraordinary. So we're going to have a little bit of time for a few minutes anyway for questions, and I'm going to take my privilege of getting to ask the first one. I think, Bill, you brought this up, and I think it's a really important point about the pandemic. How do you each see your progress with the quality and safety as we sort of emerge from the pandemic? What did you hit some roadblocks, and what do you think we learned from those roadblocks, or where do you think it's going? Do you have any comments to make given the experience of this pandemic? Maybe I'll start with Barb.
from a data perspective, we're looking into how we're going to perform some of our incentive assessments and those kinds of things next year. So that question of getting around some of those changes that they made in Q1 and Q2, especially last year with infection reporting, et cetera, we'll see how that goes. I do think something that I've been thinking about is in terms of working on hospital quality and really engaging, especially like our members and communities, is the issue of hospital quality became salient to everybody last year, and the importance of being aware of where how your local hospitals are performing, if they're prepared, and where you would go in an emergency. I think that's a nice opportunity for us to talk about some of these issues. And I see, as I mentioned, this is collective, and I think that as we reach out to members, we also talk to hospitals about how we're reaching out to members and our communities. And I think that just, using that opportunity to drive quality, they say, don't let a crisis go to waste, and this might be a silver lining.
And Michelle, I know you work directly with a lot of hospitals. How have you found it to be really keeping pressure on the hospitals to continue to report and to put a focus on quality even during times of great surge? And New Jersey certainly was an epicenter for some time.
Yes, for sure they were. But we found that although, not every hospital reported, the majority of our hospitals found the time to report. There were some hospitals that, because of the impact of the pandemic, they had to deploy some of their clinical staff that were in the quality departments to other areas, and they couldn't give it their attention. But, Leapfrog awarded one of our New Jersey hospitals a pandemic hero, and they were one of the ones that had the highest volume of COVID patients, because they were located in Bergen County, which was one of the highest hit counties, because we're right out of sight of New York City. So we got a lot of people who work in the city or visited the city and really, occupied the beds. We found, though, that, because they had such good quality, and this is what the hospitals are telling us, because they had such good quality programs in place, that it was very easy for them, although they had to divert their attention, divert their resources, they were able to still continue the good practices, the good safe practices that were in place, the good medication administration, the good team responses, the good hand hygiene, all of those things, the good maternity practices that enable them to continue. And we didn't find, although most of the elective things, but maternity doesn't fall in that, but we didn't find that there was any adverse findings that we were doing, because we also do quality monitoring of the hospital. So I think they did well based on the practices that truly are now like commonplace.
Well, that's really encouraging. Unfortunately, I think there has been some evidence across the country that there have been some struggles hospitals have had in keeping up with safety goals and quality goals, but it's encouraging to hear, and I'm sure that Horizon has something to do with it, that hospitals were recognized for keeping up with quality and safety, which again is not easy, but you recognized it and you kept that on the priority list. So I think that's a real salute to you, as well as to certainly the hospitals in New Jersey themselves for maintaining that vigilance. Has Bill, can you hear us? Has he?
Yeah, I'm good.
Oh, you're here. Okay. So, Bill, you brought up this issue of the pandemic. Do you have any comment on how you've seen your program progress through the pandemic and what you see as the lessons learned?
I think really a lot of what's already been shared. Definitely more focus from the public on quality and what that really means and how they can get information around it. For us, really nothing really changed. I guess I'd say, women did not delay their maternity care after they started. That wasn't really an option in our program, right? People still, had to go to find places they could. I think in a way, it's probably a good thing at the end, and that people are really focused more on it and wanting data. So I think we see, providers and beneficiaries seeking out the data so that they can understand it. The challenge for us, I think, is we've all got plenty of data. How do we make it simple for them to consume and understand and bring into their worlds and make their choices?
That's great. That's a good point. That you don't have much choice. You can't be just a little bit pregnant, can you? That's you're in it when maternity care is not really optional once you need it. But it's great. It's great to hear that you've kept such leadership in this area as well. Because again, that's half the battle. We really do need to just be out there and saying this matters, and we're watching. So we have like 4 minutes. Do we have? I'm going to ask Kush, who's our behind-the-scenes guy who coordinated this and did a great job. Kush, do you have any questions from the audience?
Yes, we have a few audience questions. One for the group here. Are there particular measures that you would suggest other health plans consider as high-impact opportunities? Oh, go ahead, Barb.
Yeah, something that I mentioned, I think actually all of us talked about C-section rates and these NTSB low-risk first birth C-section rates. But, just for folks who aren't as familiar, we're talking about the most common inpatient surgery. Much more, C-sections are much more expensive than vaginal birth, and experts say about half of C-sections are medically unnecessary. So, the magnitude there is so big. And then we see, with the guidance of using the data from Leapfrog and from others, and then, with learning collaboratives like our CMQCC, the change that we can see in that measure, the movement in the course of a year, can be so dramatic, with the commitment. That's a real big opportunity. And at HealthNet, we include C-section rates as one of our incentive measures. And I've heard from large hospital systems that we are the only one, even in California, that are doing that. So that seems to me a real opportunity to focus on.
That's great. Michelle, you've worked with the measures for a long time. Did you have any others that you would see as high value?
Yeah, so I agree. The C-section, the low risk C-section. I mean, there's in our network about a $5,000 difference between a vaginal delivery versus a C-section. So that's a significant saving for everyone that you can avoid. I also think the medication administration, medication errors, is probably one of the most easily avoidable complications. So that investment, we've seen that in New Jersey, investment in technology to get computerized physician order entry from the prescribing all the way to dispensing is really one that will benefit as well.
And Bill, you have 1 minute if you're there.
No, I agree. I think C-sections are a big area of opportunity. Definitely, we all see the cost differential, and it seems like an area that can be improved with the right education and just discussions across the industry.
Well, I'll thank you, Bill. I will add my recommendation in addition to, of course, our maternity data is infections. We have really up-to-date infection rates for very, very costly and very costly in human lives as well as dollars, infections that are really devastating. So we would encourage you to take a look at those as well. That data is unique. But we're out of time, so I just want to thank my fabulous panelists for participating, but also for your leadership, your inspiration every day. I think about the work that you're doing because you're making such a difference. When you look at these charts and graphs, they just look like PowerPoints, but they're really human lives that you have changed through your work, through your leadership, and through your influence. So I thank you for that and for making it what we do at Leapfrog, which is crossing T's and dotting I's. It makes it that much more impactful and important. So thank you all.
Thank you, Leah.
Thank you. And to our speakers, thank you for that great presentation and for sharing your thoughts. And thank you to the audience for participating in today's webinar. This concludes today's presentation. Thank you again, and enjoy the rest of your day.